when he got sick initially, I've had to apply for Medicaid because he was not eligible to get his Medicare or his Social Security because of his age. He got Social Security at the age of 62. You can get it at 62, but it's early. But you still cannot get Medicare. So you're still without any kind of health care there. Mm-hmm. So what I've had to do is I've had to appeal every decision that Medicaid made pertaining to my brother when he turned 62. Because at 62, they were ready to drop him, and he would not have had any kind of care. So what I've had to do is resort to file an appeal. I've had to file 3 appeals, and we're now in our last appeal.
This through DHH?
This is through the Medicaid.
Baton Rouge or Washington?
Baton Rouge.
Okay.
So I've had to file those 3 appeals, and I've been through hearings before judges. I've had to do written appeals. I've had to just exhaust whatever I could because I didn't know what else to do.
Right.
Because we needed the help, and the help was not there. And this is a person that worked. He worked all of his life since he was 17 years old, and now there's nothing available for him. And he's laying up in a hospital room, waiting to find out what are we going to do with him. This is a human being that's in a hospital, and there's nothing. Right. Now, another problem that I have seen, under Bayou Health, you have 5 different programs. And with the 5 different programs, each one of them does something differently. And they offer you attractive offers. One of them was, we'll give you a $50 gift card if you join us. And this is what we will offer you: ambulance service. We will offer you, hospital maybe twice a month, or we will offer you, everybody have their own package plan. So you have to sit and figure out which one you're going to take. So if you decide that you're going to take one and your loved one is ill, you use that hospital plan that you have selected. And if you're not covered by that hospital plan, you're stuck. Because the doctor is not under that plan. The hospital is not under that plan. The medication is not under that plan. You're stuck with a big problem. I've had to change the Bayou Health in order to get the home health assistant, because not all home health is under the same program. So in order to get the assistant at home with home health, I've had to change programs, because every home health that I called said to me, except for the one that I was lucky to find, said, I'm sorry, we're not under that program, so therefore we cannot serve you. Mm-hmm. Because he's under Medicaid, we cannot serve you because we're getting so little money, and because the money is just not enough. And they apologize, of course. The money is not enough, so we cannot supply you with any supplies that he needs. We can't come into your home and help with your brother, because if he's not getting the supplies that he needs, we don't have anything to work with. Now granted, when they come in, they're not going to come in and help me change his trach, change his dressing. They're going to only come in and to make sure that I know how to do it. But then they cannot do anything more than that. Instruct you as to how to do it and advise you what you need to do. And that's all they can do for you. If there's an emergency, you have to learn how to take care of the emergency situation yourself. You have to know what to do if you have a seizure. You can't call them because they're not an emergency assistance program. If you have questions, you can call them, but more than likely their advice is to go into the emergency room. And that's what DHH is not understanding, that whenever there's a real life situation, it's altogether different than what they have on paper. And I assume some of the people that are putting these programs together, they don't understand what's going on. Right. I would suggest that some of them would come in and actually spend a day with a family. And then they would actually see exactly what goes on. Because with me going to the hospital with him, all the issues I had with him in the hospital, then getting him out of the hospital, trying to get medication, life-sustaining medication, when that's sent to the office, and then you're told, oh, because it's life-sustaining medication, we cannot afford to give you that medication, because guess what? it's too much for us to have to give to that person. Find something else to give him. Well, the doctor is writing the prescription, and the doctors are beginning to get frustrated because what good is it doing me to write a prescription for this one human being that I am trying to make sure that his quality of life is as good as it can be, when I'm getting, calls saying, well, I'm sorry, doctor, but the company will not approve this medication, and we need the medicine because it's life-sustaining medication. But the way they are now, they're just there on paper.
Mm-hmm.
And if there's a need, you call the number and you're told that you're sorry, I'm sorry, I can't help you, there's nothing that we can do. But then I still have a human being. My brother is not brain dead. He understands, he cries, he knows what's going on. With the trach, he's able to blink his eyes. But then there's nothing that I can do but love him, because there's nothing I can do.
Right.
There's nothing I can do for him. The hospital said that they're supposed to be helping, but there's always, what am I going to do about my brother? Where do I plan to take him? Gina does not and cannot take him. The only other place is New Orleans, and New Orleans is quite a distance from the Pineville, Alexandria area. So there's really nothing. The programs need to be looked at, because there are real people out there, and real people are hurting. Families are hurting because of what is in place now. And all of that needs to be re-looked at, because I'm living it every day, and I can testify to as to what's going on. There's nothing for us, nothing available for us. And I'm afraid, because we have another session coming, and if there's more cuts, then what? Are they going to cut some of the long-term care help, the 32 hours that I do have? Are they going to cut that? And if that is cut, then what happens? Because my brother is still here. He's breathing. He's living. He knows what's going on. He has some brain damage, but the stroke has gotten him to where he can't really function like you and I can. But he's still alive. He's breathing. He knows what's going on, and it's not fair. I mean, we treat animals better than we treat human beings, and it's just such a shame.